I'll be talking about aneurysm. On April 13, 2013, my mom suffered from a ruptured brain aneurysm, and I'm here to inform you about this disease that can affect anyone around us. According to the Brain Aneurysm Foundation, 6 million people in the United States have an unruptured brain aneurysm. The annual rate for the rupture is approximately 30,000 in the United States suffer a ruptured aneurysm. There's a brain aneurysm rupturing every 18 minutes, and 40% of those are fatal. 66% of those suffer from permanent neurological deficit, and 4 out of 7 who recover from the brain aneurysm will have disabilities. According to the American Association of Neurological Surgeons, the brain aneurysm is where the blood vessel in the brain weakens, resulting in a ballooning out of the part of the vessel part. Once the balloon-like ruptures, a rupture aneurysm usually results in subarachnoid hemorrhage. A subarachnoid hemorrhage is defined on the bleeding in the subarachnoid space. There are many symptoms of subarachnoid hemorrhage. On the unruptured brain aneurysm, is a localized headache, dilated pupils, blurred and double vision, and progressive weakness and numbness. For an already ruptured aneurysm, sudden severe headache, loss of consciousness, nausea and vomiting, and dizziness and double vision and blurred vision. Diagnosing the brain aneurysm. The aneurysm could be diagnosed using a variety of image equipment. A CT scan is the first diagnosed equipment that could be used to see where the blood leaks into the brain. The MRI also helps where the aneurysm rupture is located. And the angiogram is the most accurate diagnosis, which is what the doctors mostly use, and it acknowledges the size, shape, and location of the aneurysm, but it is done through an incision through a thin tube through the groin and all the way down through the neck. There are treatment options. If the brain aneurysm is detected but it hasn't ruptured, you have many more options. Either treatment or observation is required for an unruptured aneurysm. Once the aneurysm has already ruptured, there are two mainly options, which is the clipping and the coiling. The clipping treatment is small metallic clips and along the neck of the aneurysm. This prevents blood entering the aneurysm sac so that it's no longer pose a risk of bleeding. Once it's clipped, the clipping will remain there for life. Coiling treatment. The goal of the coiling treatment is to safely seal off the aneurysm, so stop further blood going into the balloon-like aneurysm, increasing the risk of rupture and possibly rebleeding. Platinum coils are deposited in the aneurysm, reducing the blocking of blood of the aneurysm. But there is also complications about these treatments, and they also include swelling in the brain, paralysis, loss of speech, vasospasm, seizures, hydrocephalus, stroke, and even death. The rebleeding is when the bleeding goes through the brain after it's ruptured, and it could cause brain cells. Vasospasms is a ruptured blood vessels. Your brain made vasospasm. This condition can limit blood flow to brain cells and cause additional cell damage and loss. A number of factors can cause the leak into the artery wall to the risk of the brain aneurysm, which may include older age, smoking, alcohol, high blood pressure or hypertension, certain blood infections, family history or hereditary, and the gender is the women are higher at risk of a 3:2 ratio than men. In conclusion, 6 million people in the United States have an unruptured aneurysm, and 30,000 people usually suffer from a brain aneurysm rupture, and many of those are unaware that they actually happen. Tonight we have talked about the brain aneurysm symptoms, diagnosis, treatments, complications of the treatments, and their risk factors. I hope that I've given you a better understanding of the brain aneurysm that can be fatal and suffer neurological deficits and disability, and also give you options of the treatments once the aneurysm occurs. And in conclusion, I also wanted to follow up with my mother. She is now 90% much better after suffering the rupture aneurysm. She also got all of the complications mentioned before, but she's very lucky to be alive, and because she's fully almost covered, but she still has her left hand to move. And she also has short-term memory too. Thank you.